Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow-operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe. Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand, enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Once dry, your hands are now clean and safe.
Medical masks should be worn by health workers and those caring for someone with COVID-19 symptoms, persons aged 60 and over, and anyone with pre-existing medical conditions, as they are at greater risk of developing serious illness, and people who have symptoms suggestive of COVID-19. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Do not use a mask that has previously been worn or is damaged. Verify which side is the top. This is usually where the metal strip is. Identify the inside of the mask, which is usually the white side. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Pinch the metal strip so that it molds to the shape of your nose. Remember, do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. Now, how do you take off a medical mask? Before touching the mask, once again, ensure that you clean your hands with alcohol-based hand rub or soap and water. Remove the straps from behind the head or ears without touching the front of the mask. As you remove the mask, lean forward and pull the mask away from your face. Medical masks are for single use only. Discard the mask immediately, preferably into a closed bin. Clean your hands after touching the mask. Always be aware of the condition of the mask. Replace it if it gets soiled or damp. A mask alone cannot protect you from COVID-19. It must be combined with other measures, including maintaining at least 1 meter distance from each other, washing your hands frequently, and avoid touching your eyes, mouth, and nose while wearing a mask. Stay safe and help prevent the spread of COVID-19.
According to the American Lung Association, sneezes and coughs are effective ways to get rid of foreign invaders in our bodies, like germs and pollen, but they can also spread infections when not covered up. Did you know that a cough can travel as fast as 80 kilometers per hour and expels almost 3,000 droplets? A sneeze can travel up to 160 kilometers per hour and create upwards of 100,000 droplets. Respiratory etiquette goes a long way to prevent illness from spreading through direct and indirect contact from droplets on surfaces, through the air, and cross-contamination with food or water. Stop the spread. It's as easy as sneezing or coughing into your sleeve. Here's Cassandra and Joanne to show us how.
Achoo!
Notice Joanne's left-handed maneuver, while Cassandra effectively uses her right elbow. Even droplets from this big sneeze are stopped in their tracks,
Achoo!
as Joanne makes sure her nose and mouth are deep in the fabric. The best way to catch and dispose of germ-filled droplets is with a tissue. Sneeze or cough into the tissue, blow, hold and wipe, and toss it into the trash. Remember to always wash your hands or use alcohol rub after using a tissue. Good respiratory etiquette can stop the spread of germs.